Everybody, thank you for joining us here. Hi, everybody. Thank you for joining us here on the Anthroposophia Foundation podcast. Today, I'm very excited to welcome Dr. Cláudia Costa. She's joining us from Brazil, so from another part of the world, and she's very experienced in anthroposophic medicine, probably the most experienced veterinarian I know for sure in anthroposophic medicine. She's written a book on mistletoe and has been teaching around the world, and she just told me she's going to be speaking at the Anthroposophic Medicine Conference in Switzerland, which is like the big conference. So it's really exciting to have a veterinarian there representing us and our animals. So welcome, Cláudia. Thank you for being here.
Hello, Judy. Thank you so much for the invitation. I'm really happy to be here with you and with our audience.
So let's start by just having you tell us a little bit about your background as a veterinarian and how you became interested in anthroposophic medicine.
Okay. So I started as a vet in 1995. I finished 1991. And in 1995, I started a homeopathy course. I was very interested in homeopathy. And in one point, I learned how to use mistletoe. Someone very nice and good doctor in Brazil that is used to use mistletoe taught me how to use mistletoe, and I started using mistletoe for my cancer patients. I used to be a vet, normal vet. I had a big clinic, all the stuff we have and all the crazy things that happens in our clinic. But I was starting getting more and more cancer patients, so I decided to study anthroposophical medicine in 2008 to understand why mistletoe is so important and so interesting for cancer patients. And it was a huge learning. As you know, Judy, it's very difficult to practice anthroposophic medicine, but it's very interesting because you learn a way of thinking very different from the way we used to think in the conventional. We start using more our feelings and understanding that we are four bodies. We are physical body, we have etheric body, we have the mind and the spirit. So anthroposophical medicine is a spiritual medicine. And this catch me because I believe we are here for a purpose. And when we study anthroposophical medicine, we understand that if we are not aligned with our purpose, we get ill. So sometimes anthroposophical medicine can answer me why this animal is getting ill. Why a cancer in a small animal that stays at home with nice owners in a good condition. And besides this animal gets ill, gets a cancer, so aggressive cancers that we see. So this is something that I can have answers, and I have a different approach. So I can help my patients and the owners much more using anthroposophical medicine.
Yeah. As it seems to me, and you tell me if this sounds right to you, that conventional medicine just addresses the physical body. It does not address the other, in anthroposophic medicine, there's four bodies, and the energetic aspects, the emotional aspects, the energy of the humans in the household can all affect pet health. And I think in conventional medicine, it's more about just addressing the physical body and often just about suppressing symptoms, not true healing. I don't know. What do you think about that?
I totally agree with you, Judy. Because when we use, and I'm not saying that we don't need a conventional medicine. We need, and the medicine that we have now, I'm thankful for this because we have good exams. When you have an acute syndrome, you can solve with conventional medicine. But to understand how an animal gets ill for a long time in chronic diseases, you cannot use only medicines that treats the body, only the body. You have to understand all this way. The not proper thinking, the not proper feeling is always a way to find the reason why this animal is ill. And if he is ill because something is wrong in his environment, it's a way to assess the physical body, but not the only way to treat and to heal this animal. And anthroposophical medicine is what tell us, look at this aspect, look to that aspect. And all the time we are dealing with different situations like the elements, for instance, fire, water, air, and earth elements. And it makes your treatments more profound. You can go deeper. Do you understand what I mean?
Mm-hmm. Yes, yeah. Yes, the different elements. Yeah, so what effect do you think the people in the animal's life have on their health? I know this is something that you've also studied. There's a word for it that I can't remember, but how the whole household, the health of the whole household and the whole family, including the people and the animals together.
This is not very anthroposophical. This is a familiar system constellation. And we learn by some studies that all the animals are in a familiar system. We are all together, and this is a way of transmitting, information. It's all about information. And if the owner has some illness, the animal tends to have the same illness of this owner. Another thing is that this animal is so loyal to the owner that sometimes, in order not to the owner get ill, the animal gets ill. So it's very complex, but if we start studying, and then you can use anthroposophical medicine to solve all this confusion that we have in this familiar system. So sometimes the animal, like children, wants to save their owners, and they get ill for this. It's very interesting, and I see that when you can explain this to the owner, and the owner can come to the consciousness, the owner cope with you more, and the results you have when you treat your animal, they are much better than only giving medicines to suppress symptoms. That's what we do. Yeah. And one other thing that I think is so important, in the conventional medicine, we are always trying to suppress symptoms like fever. We think it's not okay to have fever, but in the anthroposophical medicine, fever is the expression of the spirit working on our disorganized body. So you have fever if you can improve your health. So we support fever. Fever is awesome.
Mm-hmm. Yeah. We've been trained in conventional medicine. Fever is bad. You have to suppress it, in both humans and animals. So you mentioned the mistletoe. What are some other homeopathic to some degree, but anthroposophic medicines that you use to treat pets or therapies?
Thing that I think it's important to tell audience is anthroposophical medicine comes 100 years after Hahnemann. Hahnemann established homeopathy, and homeopathy is the first time in history that people talks about energy using diluted medicine to treat illness. This is Hahnemann's, a German who works with homeopathy. 100 years later comes Rudolf Steiner, and Rudolf Steiner with Dr. Ita Wegman, they established anthroposophical medicine. So it's 100 years of thinking about illness in a different way, different from the Western culture. It's something that gets from Ayurveda. It comes from homeopathy. It comes from Chinese medicine. So Rudolf Steiner, Dr. Ita Wegman, it's some other people in Germany and Switzerland mainly. They organize this kind of medicine. And when we use this, we try to organize the physical body, but it takes time because first you have to use medicines that can help to organize the other bodies. So you have medicine for the liver, many plants, and always the metals. It's something that when you learn anthroposophical medicine, you associate metals and plants. For instance, the metal of liver conditions is stannum. And then you have plants that organize the liver condition, and you associating this stannum, you have better results. You can use silver, you can use gold, you can use many other different plants that we use in homeopathy, but in not so diluted solutions, but with real good results in the physical body, but looking always for the other bodies. Why your mind is not working okay? Why your feelings are not working okay? So when you organize this, your body improves.
Do you feel that conventional treatments such as like vaccines or other pharmaceuticals can impede the effectiveness of the anthroposophic therapies?
So what I think, it's not about the anthroposophic or homeopathy medicine. It's about the whole body. When you use too much toxic medicines or when you use too much vaccines, you in a way are disorganizing the body. So that's why you get ill, and not the opposite. It's not, in a way, it's turning, how can I say, there is a difficult for this kind of medicine to work. No, it's just your body is not okay to receive all the benefits that you can have when you use anthroposophical medicines. So what I tell all my clients, we need to clean the terrain to have the better results. Good food, good water, avoid toxic substances. Choose what kind of shampoo you're going to use in your dog, and where is the place this animal is sleeping, what are the radio frequencies that this animal is receiving, and all this. So if you don't clean the terrain, your results are poorer.
Yeah, right. Because health is natural, right? Like I always look at it like we don't create health. There's this thing in medicine that like people bring their animals, especially bringing like a baby animal in for vaccines and vitamin shots, because you have to make them healthy. It's like they're born healthy and perfect, and symptoms show up when things are out of balance more than we don't create it. We don't create health. I believe health comes from God. It's the natural state of the body. But when things are out of balance, then as practitioners, we can take steps to help rebalance it.
I totally agree. We are naturally health. The problem is that all the situations that we live in life, since from food, vaccines, water, emotions, everything disorganize the body. So it's something that doctors say, hey, I'm going to treat or to heal this person. No, it's the person or the animal that can heal themselves. You heal yourself by coping with your own health. That's what I always say. All this kind of medicines, homeopathy, anthroposophy, Chinese medicine, whatever, it's just a way to give a click. But if the patient is not treating himself as this animal should be treated or the person should be treated, won't get this health condition. And that's what you say. We don't give health. We go back to health. It's different.
Very much so. Very much so. So you mentioned emotions. I mean, I believe emotions can really affect animals, but how do you deal with, how do you address that in animals, like their emotional state and their emotional health, so to speak?
Yeah. Normally, our consultation is very long, 1 hour, 30 minutes, 2 hours maybe. I want to know the whole environment and the whole history of this animal, dog or cat or whatever. Because the emotion, one person never chooses an animal if this animal is not connected with this person. So in most situations, the emotion this animal has something to do with the owner's emotions. And if you have a very aggressive environment and this animal turns into an aggressive animal, normally you have to find out what happens to the liver, what happens to the eye, because we know everything is connected. And for instance, if you have sadness, you have to look after lungs and so on. Rudolf Steiner and Dr. Ilka Wegman, they paid attention to these connections because this is ancient knowledge. It's not something that appeared last century. For centuries of observation and all this knowledge that comes from ancient people observing how life goes on and talking about this. Of course, it was not written at the beginning, but now it's written. So you can access all this information. And Rudolf Steiner has something very interesting that I'm sure you know, Judy. That is the Akasha records. All the information that we need are there. So if you connect, if you learn how to use this information, you assess this conscious body, you get to understand better what's happening with this animal. so you can help this animal much more. It's very interesting. I have many stories of clients with situations that you start getting the case, you see how unhappy this client is, how angry this client is, and all this is manifested in our animals. It's unbelievable.
Can you give us a case example? Is there a case you'd be willing to share?
Oh, I have many.
One of your favorites.
Can I talk about one very difficult? Can we talk?
Yeah, go
I
for
had
it.
a situation very interesting. I don't know if it's a safe place to talk about this, but I was very surprised when I received this case. There was a lady who came to me with French bulldog with mastocytoma, mast tumor cell in his testicles. So this animal was operated. They have the operation, took all the testicles out, and it's okay. 1.5 years later, the animal came with another mast tumor cell in his gland, the skin that covers his penis. This is strong. Realized what's wrong with the situation. I'm always trying to understand. And I asked her, are you married? Because the first thing I thought was maybe there is something that is linked to her relationship situation. And she said, yes, I am married. And is it okay? I asked, is it okay with your husband? She said, I'm married to another girl. And then when I asked this, she was so angry. And I realized that she has some issues about the masculine, this energy, the young masculine energy. Nothing, I'm not against anything. I'm just telling this story. So if you think about an animal that is a male that comes to a family system, two girls living together, they have issues with the masculine energy. This animal, to stay in the system, he has to become girly. So the animal lost his penis. You understand? He turned his body. Yeah. It's totally unconscious. But to be loyal to the family system, he lost his male organs.
Wow.
It's so amazing when you can understand the situation. So to be loyal to his owners that were girls, and I'm not please don't understand nothing against
Sure. Nothing against the lifestyle. Lifestyle is fine. Just reporting what you observed.
To feel safe and to be loyal to these girls, he preferred to be a girl. So the body brings a disease that turns him in a girl, in a female. It's amazing what we do to our body.
It's interesting that they didn't pick a female dog, that they picked a male dog. Wouldn't you think they would pick a female? Like energetically, you think they'd be more drawn to a female, or was this to be part of their experience?
That was my question. Yeah. Why did they pick up a male and not a female? But maybe the system to be balanced chose a male, but it's not possible because always the disease is to bring consciousness. So if you don't look to the problem you have to face, the problem keeps occurring all the time.
Right.
You keep getting ill all the time. It's unbelievable.
This was putting that in front of them. Their feelings about the masculine energy, getting this male dog, was presenting them with that, giving them the opportunity to address that. And if they chose not to address it, then the dog continued to get sick. So it would fit in. So did you share this with them? I'm curious.
That's
just your own observation.
They are not open to understand this.
Yeah.
But I had another interesting case. It was a lady entered my room and she said to me, Dr. Cláudia, please save my dog. My father got a lymphoma and he died of a lymphoma. My brother and my cousin both they died because of lymphoma, and now my dog has lymphoma. See, it's always occurring all the same. So you have to face these issues. That's the only way to clean the system. And why is it happening? So if you think a lymphoma is about your immune system, and immune system is linked to the spiritual body, like we see in anthroposophical medicine, using Mistletoe, maybe you can reorganize the whole body, the whole system. And then you bring, all this knowledge to this client. And this client maybe will be treating this dog, getting this consciousness, can stop with this terrible illness history in her family system.
Mm-hmm. So did you help the dog? Did she have any awareness about why this was recurring in her family?
That's something very interesting. The dog passed away after some time. It's a lymphoma. But the interesting for her to look into the death's eyes, it was the catch thing. And then she said to me at the end, I'm so happy that I treat this dog and I understood that everything has a time to finish. She didn't want to finish. And now she said to me, now I know everything finishes. It was so beautiful, so beautiful. We live in cycles, and anthroposophical medicine, again, talks about cycles. It's all about cycles. And we talk about the 7-year cycles in anthroposophic medicine. It's so beautiful.
Yeah, I've read about that. And then you kind of start to go back, or like if you draw like a horseshoe shape, you start here, and I think by the time you get to 63, which is how old I am, then you start to, the years equate to your earlier years, kind of, as you go back. If you go up the horseshoe, I find that interesting because I just passed that kind of that point in my life. So I'm like, what does life hold for me now? Yeah.
Yes, you and I, we have lived for many years, so we pass all the 7-year cycles. So now we have to give back to the earth what all we received, and we received so much. I always say I'm so grateful because I'm a blessed person. So now, like you, I want to share all this knowledge with people. I think it's important because then we can, if we have all this knowledge, we can understand our own history, and then we can heal ourselves, and our animals won't be so ill.
Right.
Isn't it?
Right. So we can have much healthier animals. Our own animals will be much healthier. Yeah, it feels like a natural course of things that after you take in information for so long, it's like it's time to give back and inspire others with what you've learned. And just the life experience, there's no substitute for life experience, right? In medicine or treating patients, there's just so much you learn just by doing it that you can't read in a book or learn in a class. Yeah. So for veterinarians that hopefully we piqued a little interest in anthroposophic medicine, how would you suggest that somebody proceed, or if they're interested, how would they get started, say, integrating this into their practice?
You mean how to learn anthroposophical medicine?
Yeah, and integrate the principles. We talked about before, there's a lot to it. I mean, you could study anthroposophic medicine for many, many years, but the principles are so beautiful and so relevant. So is there a way that veterinarians could start to integrate these principles into their current practice to help improve the health of their patients?
Yes. I think one way is to get into Anthroposophia Foundation, to keep with us, because you, me, and other vets are trying to bring all this knowledge more easy to be understood, and in a way the vet can get this little drops of knowledge about anthroposophic medicine. So get into Anthroposophia Foundation website, follow our conversations. But you can go to courses, you can go to books. I'm not sure about United States. If you have a formal education for anthroposophical medicine, in Brazil we have for doctors, you can learn the basics, but you cannot go further. We still don't have a specific course for veterinarians. So I teach anthroposophical medicine a little bit. If I can use this time, Dr. Jill Rubin and we are having in April, I think it's 16th to 19th of April in Tennessee, we are going to have hands-on, but it's all about cancer, but you are going to learn more. And another way is to get in contact with these vets that are wanting to share all this knowledge, like you, me, and some others. We are not many at this time, but I'm sure we are working to get this number higher, isn't it?
Mm-hmm. Yeah. Yeah. Like we were talking about before we started recording, you said maybe we could start recording some little monthly tidbits, just little short blurbs of information, and slowly get some more specifics out there to veterinarians interested. Also, there is a forum on the Anthroposophia Foundation site where people can go in and write. It's like a private forum, so vets can come in and present, write about cases or ask questions and things like that. I think too, an important thing is just learning to trust your intuition. I think we kind of get away from that in conventional medicine. Like, everything is becoming so formulated. You have this diagnosis and you treat this diagnosis with this treatment protocols. Like, if you don't have, in conventional medicine, if you don't have a specific diagnosis, a lot of vets don't know how to treat. I see this when I read records from my patients coming in. Like, they do all these diagnostic tests because they have to have an exact diagnosis or they don't know what to do. But if you allow yourself to tune into your intuition and into the energy of your patient, I think we've gotten away from that. But we're in this profession because we're healers by nature. We didn't become veterinarians by accident. We're drawn to this because we have that ability to tune into our patients and to help them heal. Just our culture tends to drive us away from that. So I think just allowing yourself, gosh, I just feel like this would be the right thing for my patient. Kind of learn to trust your gut a little bit too.
Yeah, I totally agree with you.
Do you agree with that?
And we have to get away from protocols. All my students ask me, which is the protocol? There's no protocol. When you work with integrative medicine, you have to think out of the box to understand the animal as a whole thing. So in this situation, this is okay. In this situation, it's not. So you have to have your intuition. And this is something very delicate that we develop with experience, knowledge, but feeling. This comes from the heart, not from the mind. And that's it. And what I always say, learn the technique, but forget the technique. Because if you use this by heart, using your heart, you feel the animal, you feel the whole familiar system, then you can show a way, because you cannot solve all the problems. You can just, in a way, you can show the way. Do this can be better. And we have to get out of this positivism. Everything has to be like this. Mm-hmm. We have to teach our young people. I think this is the most important thing. We need young people in this integrative path. So then you are going to have more young people talking about feelings and not from the mind, because the mind will ask for protocols always.
Yes, yes. And with technology these days, with all the AI and everything, it's so easy for people to lose, creative thought. I was listening to a podcast the other day that said that, people use it to write, to create art. Like, people are losing their creative skills because they just use AI. And I know it's being used a lot in medicine. So we have to, and that completely obliterates the use of intuition. You just, okay, what does AI say? Let's just do that. But to me, that's at the heart of being a practitioner. Like, if I couldn't practice that way, I would just feel like a robot. I wouldn't even feel like I was helping my patients heal. That's the beauty of it to me.
I think there is a very important thing, that is the science as it is right now is exactly all men could put in a box to understand and say, this is right. But science is just a very small piece of knowledge for people. And when you think out of this, you can access more information. If you don't have prejudice, you can join, because the word is not to exclude. When you say only science is the right thing, it's excluding everything else. But integrative integrates. So you get everything all together. You can have conventional medicine, but you can have also Chinese medicine, you can have anthroposophical medicine, you can have homeopathy, you can study plants, you can do energy. There are people working with many interesting frequencies, working with frequential remedies, and they do amazing jobs. So we have to get out of this and see, let me try, because this resonates with me. And sometimes the other therapies don't resonate with me, but I can go for another ones. So, and this is how you feel, it's how it resonates with you. And then you can use all these resources to solve the case, to help the animal. That's it.
Yeah. And I think you can, by being open to that and open to the different energies, you can tap into the collective consciousness of that remedy. You can gain knowledge and insight from others just by tapping into that energetic field too. You don't always have to read it in a book. You can get insights just from the collective. Maybe that's getting a little out there, but I do believe that it's not just what you read in the book. Sometimes I'll have awarenesses about my patients, or about practicing, or about health. And I know it to be true because I've been observing it and I feel it. And then somebody will do a study or something and prove it. I'm like, well, yeah, I figured that out 10 years ago, things like that. At least it's validating that, other people are circling back and saying, okay, yeah, this is actually true. But I think we have a lot of resources and power beyond just the books, the book learning. Yeah. For sure. Well, Cláudia, thank you so much for joining us today. This was very insightful, and I always enjoy chatting with you. I think we have a lot in common, so it's always very, very interesting and very validating, because sometimes these paths can feel a bit lonely. You feel like, wow, am I just like a weirdo out there in the world, like where everybody else seems to think about things differently? So it's always very enlightening, and I hope you'll come back on again soon.
Yes, I want to thank you very much for the invitation again, for Anthroposophia Foundation, and maybe we can do this plan. I think it will be very helpful for the new vets that are interested, because they are going to get much more about health if we can share with them all we know, what we have learned. That's very interesting.
Yeah, absolutely. We'll do it. We'll connect and we'll get it set up. All right. Okay. All right. Thank you, Cláudia. Thank you so much.
Thank you so much. Okay. Bye-bye.
Bye.